All right. Thank you so much for inviting me here today. I'm delighted to be here. What I'd like to do is try and do as much good as I can. First of all, I'll introduce myself. I'm the owner and founder of Total Health Chiropractic, and we have 5 clinics here in Singapore, 10 doctors. We look after a lot of people with a lot of problems, spine problems and all sorts of pain-related problems, posture concerns, etc. We've been here 11 years, and we're very proud to say that we work with many corporations and government departments, etc. And it's my passion to come out into the community and try and educate people a little bit, try and give people information that they can apply to make life more comfortable. So today we're going to talk about extremity pain. And give you some solutions for alleviating this pain that will inevitably strike all of us at some stage. Everybody suffers from pain. It's an unfortunate fact of life, whether it be foot, ankle, knee, hip, wrist, elbow, shoulder. I think I've had them all. And my history of playing rugby and skiing and falling off motorcycles in the past, I've traumatized many joints, and I've learned a lot along the way. That's through personal experience, not just what I picked up from chiropractic and my physiotherapy training. My purpose today is to try and help you avoid future problems, prevent reoccurrences if you've had problems in the past, and if you do have some concern, to try and assist you in affecting some kind of recovery that is near perfect. All right. To do this, it's always good if you start to think like a chiropractor. You don't need to become a chiropractor, but it'll certainly help you if you start to think like a chiropractor. So, who here remembers when you were young? When you moved freely and gracefully, no feelings of pain or encumberment? Don't you wish you could go back to those days? I know that I do. I work extremely hard maintaining my youth. And if there's anything that ages you, it's a feeling of stiffness and pain. But the good thing is, we are miracles of evolution, and we are all the time growing into a new body. So if we can get the body back into balance and give it what it needs and take away what it really doesn't need, then we've got an amazing opportunity to heal. Think about your body. It is a miracle. You have 206 bones, over 360 joints. We are designed to move, for locomotion. All your joints, they work in different ways. Some of them hinge. We can lift, we can pull, we can push, we can rotate. Our joints are amazing, and they are designed to last a lifetime. The problem is, I guess, is that we've created an unnatural world whereby we're putting our body through things that really we're not designed for. And we could probably say that we're living actually longer than was intended by God. Today, I think I'll focus only on 4 joints, because this is a huge subject, and I've got to go through these 4 joints pretty quickly as it is. So I'm going to talk about hips, knees, elbows, and shoulders. And what you're going to see is that these problems will apply to most people at some stage. And what you'll also see is that the same principles will apply to most of your joints. Okay? So let's learn how to look after our joints. First of all, who's at highest risk of joint problems? Obviously, the elderly. There's more water under the bridge. We've been subject to more trauma, if you like. People just tend to develop frailty, and problems build up as you go through life. People with a sedentary lifestyle, which is now nearly everybody in Singapore, causes a huge amount of problems. Remember, we are designed to move. And then sports people. We put our body through a lot of stuff. I consider myself a sports person. I do some kind of sport pretty much every day. And we do put our bodies through a lot of trauma, even though sport is good for strengthening and etc. So let's think about how we want to be in the future. Think about your body now. Do you have pain, stiffness, etc.? What is your body telling you? How is it communicating with you? And how is it going to feel if you stay on the same trajectory? How do you think it's going to feel in a few years' time? We can't all be elite athletes like me, joke, but we need to think a little bit like athletes, because we should look at life as a bit of a marathon. You know, we want to be around for 90 plus years, and we want to enjoy life, get the most of it, live to our potential. We do not want to live in pain, but unfortunately, most people tend to live in some kind of pain. And it's starting earlier and earlier in life. I'm seeing many people in my clinics who are already stiff and achy in their early 20s. And it's down to sedentary lifestyle, poor alignment, and today I'm going to hopefully turn on a light in your mind, so you can start to realize how your body's communicating to you, so we can make some changes. It is an absolute truth that your joints will determine how comfortable you are in your own bodies. All right? It's very important that we understand that our weight-bearing joints will determine our ability to navigate life. They will determine to a great extent our health span.
Hey, I want to give you some bihun. My mom saying your
Guys, can I just jump in there? Can you make sure that you all have your mic muted for me, please? Thank you. Appreciate that. Yeah, so how comfortable you are in your body, the quality of your joints will go a long way to determining your health span. How many good years you have? And then, of course, this is going to go a long way to determine your lifespan. I think these are very important considerations. A quote by Carol Walsh: movement is a medicine for creating change in a person's physical, emotional, and mental state. Now, it's quite an involved sentence, but in this crazy, crazy world that we have created, one thing is almost guaranteed. But if we improve our physical motion, we improve our movement by exercise, it's almost guaranteed to improve your physical, emotional, and mental state. You will simply be in a better place so that you can get the most out of life. When we move, when we exercise, everything strengthens. We become conditioned, strong, and able to stay the distance. But as soon as we lapse into this sedentary lifestyle that's so endemic in our society, unfortunately, everything starts to weaken and we slide into deconditioning. Things start to break down, things start to go wrong. All right, so let's move on to our first joint that I'm going to talk about today, the shoulder joint. Everybody will have shoulder pain at some stage in their life, of that I'm sure. It's the most unstable yet movable joint in the body. I know that when I put my body through a lot of strain, I'm using my arm an awful lot as a lever, and all that strain goes through the joint. It's actually a very complicated joint, and so many of the injuries that we have with our shoulder turn out to be syndromes. So that means they're more complicated, and there's a few different aspects which I'll go on to mention. Typical areas of shoulder pain, and I think this will be quite familiar to many people: sprains and strains, tendinitis, bursitis. You might have heard these words, I'll mention in a moment. Muscle and tendon tears, instability, arthritis, wear and tear, shoulder impingement, and frozen shoulder. These are words that you might become more accustomed to as you go through life. if we think of the anatomy of the shoulder, it's quite an involved ball and socket joint with a very big range of motion. Three main bones involved: the humerus, the top bone of the arm, the clavicle, the collarbone, and the scapula, which is your shoulder blade at the back. Two main joints involved: the acromioclavicular joint, which is the joint between the scapula and the clavicle. That can cause problems, and the glenohumeral joint, which is the ball and socket joint that you're more familiar with. The rotator cuff is what gives us this huge amount of motion, and this comprises four main muscles, and then lots of ligaments and tendons all involved there. Then, of course, you've got the biceps become involved, the triceps, and the deltoid muscle. These all come across the shoulder and can all be involved in problems. Where these muscles join the bone by tendons, these can become inflamed and you get tendonitis, which many people become familiar with. So the syndromes that very often become involved in this quite complicated joint: bursitis. You have a bursa, which in the joint, which is a fluid-filled, slippery cushion, if you like, which cushions the tendons. Where the tendons slide over the bones, they can become inflamed, and anything that says itis means inflammation. So you'll actually find that almost every single pain or syndrome that we might become accustomed to, it's always involved inflammation. Tendonitis, as I mentioned, is where the muscle pulls on the tendon, pulls on the bone. This becomes inflamed with constant use. A very, very common source of shoulder pain. Now, we can also get impingement. People who are lifting, maybe workers that are decorating the ceiling or plastering, or anybody that's doing a lot of work above, can get an impingement syndrome of the shoulder. And that's where a tendon usually gets pinched between two bones of the shoulder. Very, very painful, quickly becomes inflamed. Once you've got inflammation, you've got this problem that is quite hard to get over, because it's all got to calm down, which means we've got to stop doing the thing that keeps aggravating it. And then, of course, you've probably heard of frozen shoulder, which has nothing to do with ice becoming cold. It's due to when we get inflammation in the joints, gradually we lose our ability to move the joints, and we get something called adhesive capsulitis. So in the joint, there's a capsule which becomes inflamed, and you start getting adhesions, and then the whole shoulder becomes very, very difficult to move. So we'll talk a little bit about how we go over this. One thing's for sure is whenever you've got any kind of problem, you should first try rest and some icing, because there's nearly always some inflammation, and by icing, that can reduce that inflammation, which is a good place to start with getting over the problem. Many of these shoulder problems are much worse at night because we tend to sleep on our shoulder. We should always sleep on our back or on our shoulders. Most people will sleep on their shoulders at some time, and it becomes painful because there's inflammation, and it all becomes very stiff and painful. And then this becomes worse when it's compressed. So if we're sleeping on the shoulder, then it can become more inflamed, and we can start even getting numbness and tingling down to the fingers. We need to just get the pressure off it. Okay, so let's think of some healing strategies for our poor, overused used shoulders. First of all, if there's any kind of pain or inflammation, impingement, we want to immobilize. That's the first thing we do. Let it calm down. Maybe ice it, maybe try some anti-inflammatories. So these can be natural, so that would be things like turmeric, etc. Or if you're going to use over-the-counter drugs, then you could try ibuprofen, NSAIDs, Nurofen, Advil, or aspirin, or something like that. I prefer something more natural, so I always incorporate an anti-inflammatory diet into my daily well-being strategies. We definitely want to employ a gradual restoration of function. So after we've rested it, we want to get controlled movement back as quickly as possible. We do not want to be healing with a joint that's not moving, because that's when we can get frozen shoulder, right? And this becomes more of a problem, I think, when we're aging, because there's more damage in there. There's been more overuse, just problems of age, just building up, more inflammation, more wear and tear. Okay, so we do always want to get range and motion back, and that's why some kind of rehabilitation through seeing a physio or a rehab specialist or chiropractic will all help restore function. Okay, we always want to restore function. If you have any questions regarding anything I'm talking about, please use the chat. I'm going to address this at the end. I like to have a good question and answer session at the end. So if anybody has anything for me, then please pop it in the chat. I'm also at the end going to give you the opportunity to have a subsidized visit to our rehab specialist. So she is a specialist in shoulders, knees, and hips, and elbows, or for a chiropractic check, which is more to do with the pelvis and spine and posture and anything related to that. Okay. Now, when you are dealing with these problems of joints, when you should definitely think more seriously about seeing a doctor, if you see some kind of deformation, something doesn't look right, the joint looks deformed, it's not working properly, and maybe there's a lump, or it just seems to be out of place, all right, that would be a sign. If you can't use your shoulder at all, and it's just literally jammed, and if there's intense pain, so the body really is screaming at you in no uncertain manner, then I think these would be times to see a professional. If there's any sudden swelling, that would be a sign. And then definitely, if there is any nerve involvement, so by that, I mean, if you're developing weakness, so perhaps a weakness in your grip, you can't raise your arm, or maybe you're getting some numbness or tingling down your arms, I think it's important that you start to think more in terms of seeing a specialist. Okay, this doesn't have to be expensive, but I just think we want to make sure that there's not something more dangerous that we want to address. Okay, any questions about the shoulder, then do pop it in the chat. I'm going to move on to the hips and the side joints. Your hip is the largest ball and socket joint. There's a lot of pressure, force that goes through this joint. So wear and tear is probably our main concern. And then, of course, you've got a joint that's a ball and a socket. If you have poor alignment of this joint, then you're going to get uneven wear and tear. And this is probably the #1 cause of serious long-time problems. Something about the hips is that the origin of the pain can quite easily be mistaken. So let's just think about that for a second. If we look, all right, let's go back for a moment. I want to talk about, if you look at the femoral head there, that sits in the acetabulum, which is part of the ilium bone of the hip. Now, when you're getting pain in this area, this pain can come from various areas. It can actually come from the low back. It can come from the pelvis itself, where tight muscles pulling on the pelvis. It can come from your SI joint, which is your sacroiliac joint, which is, you can just see it there, where the sacrum that the spine sits on joins the actual pelvic bone. That's called the SI joint, and that can become a little bit distorted. And then if you have pain in there, that can create difficulties of walking, putting weight on it, and things like that. Okay, climbing the stairs again is a typical problem. Even getting in and out of cars, if anybody's familiar with that problem. And then, of course, you can have hip pain, which is the actual hip socket, which is the bone where it sits in the socket, the acetabulum. We can get wear and tear in there. So the pain can actually come from different areas. And then when you look at the anatomy of this area, I think you can see that there's quite a lot going on. There's a lot of muscles, a lot of tendons, a lot of connections. There's a lot of areas that can go out of balance. So I think you can see there that it's quite a complex, highly functional region that we put a lot of force to. Remember, we're meant to do 10,000 steps a day. 10,000, yeah. We've got this immovable pelvis, if you like. It doesn't move that much. But then you've got this spine sitting above it. That moves quite a lot. But then you've got this highly movable hip joint, where, and then this is all tied together with muscles and tendons and ligaments. So it's very easy to see how a poorly aligned pelvis, in terms of a tilt or a twist or anything like that, can cause some problems. As chiropractors, we take a lot of X-rays, and this is just an X-ray from one of my clients a couple of years ago. I've used this because it's very easy to see how something as simple as a leg length inequality. So this was a guy whose pelvis had dropped on the right-hand side because of a short leg. And you can see it's tilted the pelvis. There's also a twist in the pelvis. We can see that, creating a twist in the low back. Now, this person is likely to have more weight on one side, a lot of force going through the joints. Because of the twisting, there's going to be tightness. And this is all causing changes. The body's remodeling. And almost certainly, this is going to result in arthritis and bone spurs and stiffness and aching and pain, a lot of stiffness in the morning and gradual deterioration. So eventually it's likely this person will probably need a hip replacement. All kinds of problems will end up in the spine. Remember, weight-bearing joints that are out of alignment will eventually break down. Okay, the orthopedic surgeons that fly around Singapore in their Maseratis and their Mercedes-Benz, they're onto a good thing. They can get to the hip joints, they can get to the knee joints. There's a lot of people with traumatized joints because of bad alignment, and then it's easy for them to replace these joints. But I will remind you, there are plenty of other joints that are not easily replaced. So I'm talking to your spinal joints, which are also weight-bearing joints that quite easily are out of alignment. All right, we should always look at the structure, always. So let's think about the structure and come up with a few healing strategies. You'll start to realize that I'm mentioning the same words over and over again. First of all, rest. Every now and again, we need to rest these joints. We need to take the weight off them. We need to give them a chance to do some healing. Ice to calm it, to cool it down, just to reduce that inflammation. Obviously, the use of anti-inflammatories, whether they're natural or whether they're pharmaceutical products, these can also help, of course. And then gradual restoration of function. Well, that means definitely getting these joints back into alignment and then getting the joints moving properly. So we have to make sure they're in alignment, whatever it takes. Probably some rehabilitation. Certainly, you'll probably need an examination to have a look. Gait analysis. We need to look at you. How are the joints moving? Is there any twists in there that's obvious? If not, maybe an X-ray can just give a very simple light bulb moment. So a very simple therapy. Somebody's got their microphone on. If you could turn that off, I would be forever in debt to you. So rehab therapy of some description, whether it be physio or chiropractic, but restoring function in a controlled, gradual, you need a plan going from being in a state of distress and inflammation and pain back to a functioning joint that is moving easily, that will actually go through a process of regeneration and not degeneration. Okay? Always, we have to look at alignment, we have to look at structure, and we've got to look at the delivery of blood. We should always remember that the body's delivery system of nutrition and blood, hormones, all the chemistry of life is through the blood, right? So we need to have good blood supply to these joints. If the joints are becoming stiff, there's less blood getting in there. So we've got to think deeply about how we can restore the blood supply. And while we are sort of removing toxins and things like that, that might be contributing to the inflammation. Okay, we'll talk a little bit about that at the end. So I'm going to move on to elbow pain. This is my most recent pain, if you like. I do a lot of manipulation of spines. I put a lot of force through my elbow and through my shoulder. This particular strain that I recently had ended up in me getting tendonitis on my elbow, and I'll come to that in a moment. My particular pain had a name. They call it golfer's elbow, which is actually medial epicondylitis, but we'll come to that in a moment. The elbow is not weight bearing, but it is load bearing to an extent because all the muscles have to work through the elbow. Generally, we're not prone to long-term chronic pain. So if you do have elbow problems, usually there's a light at the tunnel. Usually it's quite easy if you know what you're doing to get out of pain eventually, okay? And become more comfortable in your own body. Typically, we end up with strains and sprains. The difference between a strain and a sprain is this. A strain is a muscle injury. Strain is muscle or tendon. So the muscles are these contractile soft tissue that move bones, okay, across joints. And if you cause a trauma to it, you can strain the muscle and you can strain the tendon, which is the insertion of the muscle on the bone. However, a sprain is an injury to the ligament, and ligaments are soft tissue. They are fibrous collagen that go across joints, and they stop joints dislocating. Their job is to maintain stability in the joints, so they stay in one piece. Every now and again we can get these small dislocations or major dislocations. As chiropractors, we're always straightening out minor dislocations, but we're all aware that we've heard of people that dislocate their shoulders or their elbows, very painful. And it's the ligaments that are there to stop these, to prevent these dislocations. But I sprained my ankle recently walking on the green corridor. I went off the side, foot went down a hole, it went over, very painful, and I had inflammation of the ankle. This was a sprain. I strained a ligament, quite painful, iced it, immobilized it, raised it, did all the things that I know we should do. And then gradually I restored the function. The inflammation has nearly gone now. I'm almost back to my fighting ability. Okay, we always want to restore function as close to 100% as possible, because we don't want to eventually develop arthritis. Arthritis is a very simple word that means swelling of a joint. If it's acute, like my ankle was last week, you get swelling. But if it's chronic, if you've got chronic inflammation of a joint, then that becomes known as osteoarthritis, and we start getting fibrosis and stiffening and bone spurs and degeneration of the cartilage, and we lose the blood supply and things like that. That's why it's so important that we get full range of motion, everything in alignment, back as quickly as possible. So I mentioned my elbow recently. That was medial epicondylitis, and that was an overuse injury where I put too much force through my forearm where it was pulling on my elbow, and it caused inflammation, and it really did affect my activities of daily life. What did I do? Well, I rested it, I iced it, and I got an elbow strap, and I applied that, and that took the pressure off the tendon, and then it took about 3 weeks before it all calmed down. Okay, again, when you know what you're doing, it gives you a huge advantage, really, because you give yourself your best chance for full recovery. So that was me. That's a problem with the tendon that pulls on the medial side, the inside of the elbow. If it's on the outside of the elbow, it becomes called tennis elbow, and it's pulling on the lateral epicondyle, which is right in there. Again, very painful. That affects people who play tennis, etc. Again, rest, ice, and then using one of these straps will help enormously. So that's the tennis elbow. There's the medial epicondylitis that I suffered, which is called golfer's elbow. Right. The strap that I used is something that looks like that. You apply it, when you're going to use the arm, you tighten it, and it really does take the pressure off that elbow. So the solutions: rest it, ice it, anti-inflammatories always, to reduce the inflammation. Improving technique can be important. During that period of pain, I definitely did change my technique when I was adjusting client, and I just prevented myself putting so much force through that particular elbow. Now, when you have got some kind of problem, whether it involves swelling of a joint, tendinitis, you will probably find concentric exercise painful. So concentric, so for example, if I'm making a bicep, okay, then my muscles here are pulling on my humerus here, all right? So this is concentric. Now, that's going to be painful because the muscles are pulling. So if I want to exercise that, it's hard to without causing pain. So what I'm going to do is eccentric exercises, which is the opposite, if you like. So I'm going to give I'm going to use a small weight, so that my phone is my weight. I'm going to lift my weight, but I'm going to help it with my other arm. Okay. Now, what I'm going to do then, I'm going to let go. And now I'm going to let my arm and the weight go down slowly. So it's lengthening. So shortening the muscle is concentric, lengthening it is eccentric. Okay. So doing eccentric exercises, this is how you want to exercise these joints while you're healing from tendinitis. I hope that makes sense. If there's any questions, stick it in the chat at the end. Okay. Right. Now we're going to move on to knee pain. This is something everybody gets. I've certainly had a great deal of it in the past. I'll tell you why in one moment. Chronic knee pain does affect 25% of adults, but I'm going to go on to say it affects 100% significantly at some stage in their life. Let me tell you how I injured my knee. Many, many years ago, I was working in cold northern England. I was playing rugby. That was my sport. I played really hard. I played really tough. A lot of wear and tear, a lot of hits. But what I didn't know, and I was an engineer in those days, I wasn't a chiropractor, I was an engineer. So when I think about it now, I should have known better. Because in engineering, we have an expression: structure determines function. If the structure is bad, you'll have poor function. Except I never applied that to my own knee. What I had was I had a knee that was out of alignment because I had developed, without knowing it, flat feet. So flat feet, running around on frozen rugby pitches in Northern Europe, caused my feet to flatten. And that allowed my feet to roll in, putting my knees out of alignment, and then all that trauma, all that running and training and sprinting gradually wore down the cartilage in my knee. Terrible, terrible pain. Eventually, I had to have a cartilage transplant. I wouldn't wish that on anyone. Luckily, I became a chiropractor. I learned how to totally rehab my joint. I had a transplant. I changed my diet. I got perfect alignment through the use of orthotics and manipulations of the knee and the hip through chiropractic and physiotherapy. And I rehabbed my knee cycling up the hills of San Francisco all those years ago. So I know a lot about knee pain. It's very, very painful. Every step that we take, remember, we make 10,000 steps a day, or we should do. For every pound of weight that you carry, when you are walking, it exerts 4 pounds of force through that knee. If you're running or running up and down stairs or jogging or anything like that, or jumping, there's a lot more than 4 pounds worth of force for every pound of your weight, okay? The reason why this joint is really easily damaged is that it's a hinge joint, and hinge joints are meant to be straight, a straightforward hinge, but there is some twisting. There is some twisting. So it's when we're twisting and putting force through our knees, that's when we tend to do a lot of damage. I know that I do a lot of skiing, so I'm doing a lot of twisting and a lot of force going through my knee. So when we come to the ski season, you bet your bottom dollar that I'm doing a lot of rehab for my knee. I'm getting it ready, flexibility and strength. I'm basically getting all the reflexes and getting all the muscles so they work in a very coordinated fashion. So I can take a hit. Okay. So really, when you think about the knee, it's no real surprise that trauma, or the trauma of steps or of misalignment, it can all take a toll. It tends to build up. Bioaccumulation is what it's called. And then it doesn't have to be that way, though. I think knees are designed to last a lifetime. Knee pain is preventable. And if we do have knee pain, we can recover from it if we get the basics right. Like many joints in our body, we can get tendonitis. Pain at the front of the knee is very often tendonitis. We can tend to get bursitis. So remember, bursas are these tiny little fluid-filled sacs in our knee that tendons tend to rub over. So if things are out of alignment or we're doing something repetitively, then we can get inflammation of the bursa, and that becomes bursitis. Remember, itis means inflammation. And something else called chondromalacia patella, runner's knee, if you like. This is where we get damage to the cartilage on the underneath of the kneecap. I myself have had this in the past. Again, very painful. I developed this as part of my knee problem when my knees were out of alignment. Now I'm all good. You'll definitely notice chondromalacia patella when you're taking the stairs or walking uphill. Very painful underneath the knee. Osteoarthritis, I've mentioned before. That's basically wear and tear of the joints. Very common in the knee. Can be typified by tears in the cartilage, so that would be a twisting injury. Bone spurs, where the tendons pull on the bones, that can create bone spurs as the body tries to reinforce a very tight muscle. And then we can have micro injury, so that's a buildup of micro trauma. So just running can do that, or macro trauma. If you fall down the stairs and you get a really bad twist, that's the type of thing like skiers tend to have, or sports people. And then again, we can get strains, of course. Strains apply to the muscles and the tendons And then, of course, we can get the sprains across the knee. There's the runner's knee. There's a lot of runners in Singapore nowadays. If you think about the knee, let's just have a look inside the knee. We've got the meniscus. You can see the meniscus there in red and purple. These are the rubbery cartilage between the bones that act as shock absorbers. And they are designed to last a lifetime, but the knee's got to be in alignment. And it's so easy, if there's twisting injuries, to damage that meniscus. Sometimes you've heard of people having microsurgeries where they go in with cameras and you have little tears in the meniscus. That's when they trim all the tears off, and hopefully we're good after. Sometimes not. It's very important always that whatever is the cause, if it's misalignment, that always has to be part of the rehabilitation. Okay, a torn meniscus is one of the most common knee injuries, and then of course we've got the ligaments. We've heard of ligament injuries. We've got the cruciates, the anterior cruciate, which is the blue one there. We've got the posterior cruciate ligament, which is the yellow one on there. These are very debilitating injuries that usually end up in some kind of surgery. And then we've got the collateral, the lateral collateral, which is the outside of the knee, and the medial collateral, the inside of the knee. Again, twisting injuries that tends to inflame or sprain these ligaments. Okay, again, we just need to help them calm down. We look a bit deeper into the anatomy of the knee. We can see that there's all these bones and tendons, and there's a lot going in there. So it's very easy to see how a poor distribution of load can lead to a breakdown of the cartilage. And remember, if we're stiffening, we're not getting the blood supply, and then we can get the inflammation tends to bring in toxins, which will eventually cause all sorts of further problems down the line. Okay. So I mention alignment a lot. When I walk around Singapore, I see a lot of people with bow legs. I mentioned my knee problem. My knees went out of alignment. They were slightly moving inwards because of my feet were rolling in. We really should try and recognize this as early as possible in life. And there are ways of strengthening the different muscles of the legs that will help bring them in or restore. Sometimes we need to use orthotics for the feet. Sometimes we need some kind of strap for the knees, and gradually tighten the strap to gradually straighten them out. These are things that there are all sorts of strategies, but alignment is vital. Unfortunately, if you have bow knees, then the chances of you needing some kind of knee replacement or hip replacement in the future is highly, highly likely. You can see in that X-ray there, again, what do we have? We have a leg length inequality, which is causing a tilt of the pelvis and a rotation of the pelvis. Again, the hips are going to be out of alignment, the knees are going to be out of alignment, the ankles are going to be out of alignment, the low back's going to be out of alignment. All these joints, the SI joints, these are all going to be then subject to micro trauma and a gradual deterioration as problems accumulate and build up over time. Okay. So some tips for healthy knees. We really must work with our muscles. We really must strengthen our quads, which is the big muscles on the front of our legs, and our calf muscles, the lower part of our legs at the back. We must strengthen those. There are various ways of strengthening these by doing little squats and things like that. And it's really important that we warm up and stretch these joints. We've got to stretch our hamstrings, stretch our hip flexors. Remember, this is a sedentary life. Somebody once said to me that, our ancestors used to move 200 times more than we do. I thought that can't be true. But then when I thought about it, I thought, you know what? If you take away desks and computers and schools and things like that, I think our ancestors probably did move 200 times more than we did. It's an incredible statistic if you think about it. We've got to restore movement into our life so we're not stiffening. If we are sitting all day, then we get short hip flexors. So these are the muscles at the front there, front of our hips. We've got to stretch those. At the same time, our hamstrings, they become short as well. So we've got to learn how to stretch those. If we're exercising and we're exercising on stiff joints and stiff muscles, this is when we like to pull muscles, okay? So we really want to be warming up before we exercise. One of the best ways of warming up for almost everything is a nice walk. You know, just walk for a kilometre, gradually build it up, and then just do some stretching. I mentioned there adequate foot support. Very, very important that you don't have fallen arches in your feet. And then, of course, full range of motion. I remember one of the first times when I broke my leg. I've done it a couple of times because of my crazy life in the past. Once I remember I damaged my ankle right at the bottom there, and they put me in a pot, and so I could not move it for a great deal of time, and it was so stiff when they took that pot off. Now what they tend to do is they tend to immobilize it, but they encourage movement back into it much more quickly. So they tend to have more in the way of straps that will mobilize, which they will gradually loosen up, so you can gradually restore movement in the joint. Okay, so let's think about how we can get our knees working and moving again. Obviously, we've got to address the movement, we've got to address the inflammation. I think that everybody should have some kind of knee-friendly cardio exercise. I put down a few there: cycling, walking, elliptical machines, swimming. These are my go-to. I do a lot of dog walking. When I go to the gym, if I'm not on the cross trainer, the elliptical, I'm cycling, because I look after my knees and my hips. I'm a skier. I want to be skiing for another 20 years. So I want to exercise these joints while they are in good alignment. Okay. Jogging in the water, if you're particularly bad and weight bearing is not good for you, then just getting in the water, walking in water while you are a little bit supported by the flotation of your body in the water. This is all good. No-nos for your knees. As you're exercising, if you have slight discomfort, it's probably okay. Slight discomfort. If you've got damage and we're trying to rehab, then you'll probably have a little bit of pain. You know, the body's reminding you. I think we should be communicating with our body all the time. But if you get sharp, sudden, shooting pain, any zingers down the leg or anything like that, anything that involves collapsing, you know, you collapse onto your knees or something like that, then really you need to be seeing a specialist, okay? Do not power through. You know, that you can't exercise through certain pain, right? Just listen to your body. Usually it's telling you something. Just moving on to my last slide for my how to improve these joints. Let's just think more generically about how we should look after ourselves. What we put into our body really does become us. So if you're having food that is not whole food and it's made in a factory and it's got loads of ingredients that you can't even recognize, it's probably not good for you. Our body is made of macronutrients, proteins and fats and carbohydrates, and we want those forms of food in the most natural form. So whole, real food and rich in vitamin C and micronutrients. Very, very important. We're talking about bones and joints. So we want to be in the sun. Too many people hide from the sun. We're not getting enough vitamin D. Vitamin D is very important because that helps make the bone. It helps create bone. And it's worth noting But it's vitamin. If you're taking a vitamin D supplement, which I personally do because I don't get out in the sun quite as much as I would when I lived in Spain, I take vitamin D3. Now you should also take vitamin K, K2, because that is what really takes the calcium out of the blood and out of your soft tissues where you really don't want it, and puts it in the bone, right? Combination of vitamin D, D3 and K2, okay? Any questions? Let's put that in the chat. Quality sleep. Quality sleep, when we get into deep sleep, which is the later part of the sleep cycle, stages 4 of our 5-stage cycle, this is when the body releases growth hormone, and that's when we go through the process of building and repair. If we're not getting quality sleep, we're not getting into deep sleep, we are literally not repairing properly, right? Very, very important. Many people have got various forms of arthritis, things like rheumatoid arthritis, psoriatic arthritis, all the aches and pains that are associated with bad nutrients getting into the blood from the gut. We have to have a healthy gut. If we don't, things that go through the gut can get into our blood and end up passing to our joints, so they become inflamed. We've got to have a healthy gut, so you need some strategies. My strategy for a healthy gut and to get the healthy, the nutrients for collagen and all the minerals is bone broth. I make sure that I have a good bone broth. I try and have it every week, but certainly every month. I'll certainly be taking it for a few days. If you can get those joints out of whether it be chicken or beef or whatever, I'm wanting the collagen. I'm wanting the minerals, the proteoglycans. I want all that good stuff that it gets leached out of these bones as you make a bone broth by boiling it, simmering it for a couple of days. Very easy to find this information online, by the way. Lots of healthy recipes. Bone broth is really one of the most amazing things that you can take into your body for helping the gut and helping your joints. Daily movement. If we're not moving enough, it is a recipe for arthritis in the end. Remember, stiffening hastens aging. If we all age, but we don't have to age with stiffening joints. We have to look after them, give them what they need, take away what they don't need, give them a chance, and they will move back into balance, back into strength. I think you know what I mean, okay? Alignment, range of motion, these are things that we should all be working with. And supplements that I take on a daily basis, I take glucosamine because that helps the formation of cartilage. And I mentioned collagen. I make sure I'm getting my collagen through bone broth. Sometimes I will supplement. I take fish oil every day. I want the omega-3 fatty acids. And I have a magic potion which I take every day, which is turmeric and ginger, which we crush, we get all the juice out, and I take it like a shot every day. Every single day, without fail, I put a little shot of turmeric into my body. It's probably the most fabulous natural anti-inflammatory. Remember, we must keep inflammation down in our bodies. Okay, now I've gone through a lot of stuff there. We'll have a look at the chat in just one moment. I want to introduce Grace to you. Grace is our wonderful rehab specialist. She's in our clinic in the CBD in Capital Town. She is our resident expert in all the joints I've been mentioning. Usually it's $100 to see her. I've just put a nice introduction for you there. You can come and see her for $60. You can there's the email. You just email info@totalhealthchiropractic.com.sg, quote THC rehab, I'm going to make this whole slide presentation available for you in a PDF form. So you can just pop that in the chat or let somebody know and we can get that to you so you've got this information. If anybody wants to connect with me, if anybody thinks they have postural problems or they have problems with their spine or their pelvis or anything like that, then please engage with me. Ask any questions you want. You can always contact me through our website, www.totalhealthchiropractic.com.sg. There's my email address there, drtim@totalhealthchiropractic.com.sg. I don't hide, I do answer. Remember, I'm here to help. Just make sure you've got this information so you can address me whenever you want. Okay, right, a lot of stuff there. I'm going to have a look at the chats. If anybody wants to ask me verbally questions, I'm here. I'm here to help. So, what have I got? I'm just looking down them right now. Looking down. Right, Tiffany. I've been having a nagging shoulder blade pain since my first vaccination injection. Got it. Not sure if it's due to the vaccination, but it's started right since then. I didn't do any strenuous exercise during that period, so there are unlikely any other causes. Could there be a reason why? Yes, so this vaccination has had a habit in hypersensitizing our immune system, and it's brought many problems to the front. With you, it's your shoulder blade. So let's just talk about that. I'm going to hazard a guess, Tiffany, that you are sat at a computer now. You probably sit at a computer many hours a week, and I'm going to suggest that your muscles at the back there are tighter than they should be. Okay, maybe you've got some stiffness in the neck as well. This would be very common with if you're sitting all day with your head forward. Remember, if you've got stiffness at the back, then this is affecting the function of the joint. So there's going to be some stiffness. Eventually, something is going to bring it to the surface. Why is it one joint and not the other? It has to start somewhere. Many of our clients come in with both shoulder blades tight, some just one. I want to introduce you to something that is called reciprocal inhibition. Very, very technical. You don't need to remember that. But what you do need to remember is is how it works. Again, let's go back to my enormous bicep. So if I bend my arm with my bicep, the tricep is turned off. It releases, and that's a reflex. So one muscle fires, another is released. So let's think that through in the body. If you've got tight shoulders at the back, there, shoulder blade, then you've got weakness at the front. So you're going to have weak shoulders. So it's likely that you're going to start causing some pain or some kind of damage to your shoulder if you're tight at the back and weak at the front. Many people have pain at the bottom of their backs because their backs are so tight because they're sitting. If your backs are tight, your abs, your stomach muscles are probably weak due to the same syndrome, this reflex action. Okay, so we've got to go back to the cause. Now, I believe that the vaccination is not the cause. I believe it's the trigger. Okay, we've got to go back to the cause, which nearly always is alignment and some kind of repetitive use. Okay. The more I rub the area, the more the pain. I'll face more pain the next day. Yeah, you know, we want to get the joints moving. We need to get the blood supply back. Long-term hip pain lead to imbalance after a year. My body either leans to the left or right, and I will wobble or shudder. Anyway, to correct this. Okay, so look, if the pain is causing a change in your posture, there's going to be consequences. You know, we really want to try and get back to balance as quickly as possible. If if it's making you lean to one side, you're going to create other muscle imbalances. It's going to cause some more problems down the line. I really do think you need an evaluation, perhaps in one of our clinics or with Grace. So that would be my recommendation here. Also first pain. Yes, chiropractors, we have a lot of pain as well because we are so busy fixing other people, leaning over people. We tend to go into misalignment as well. So we all have strategies to realign our bodies, so we don't suffer ourselves. If you go for acupuncture, TCM treatment, yeah, that is great. TCM, acupuncture, cupping, all those things, scraping, massage, these are all great for alleviating the muscle ache, but it's not a long-term strategy. Remember, you have to get structural alignment recovered or it's coming back for sure, okay? If there's any takeaway, it's gonna be that. You've got to get alignment restored. Okay?
Tim, there's one question about hip flexors, stretches. So we can send a PDF, can't we, to the PA on that one, and they can distribute that.
Yes, absolutely. Hip flexors, we can send you something for that one. I do hip flexor stuff all the time actually, and I literally just stand up and I feel you've got tightness here, so you've got to lengthen this. So I do it by standing up. I've got my legs straight. I'm pushing away, and I'm feeling a real pull in there. But if you send us your email, I can certainly send you some stretches for the hip flexors that will help you enormously. Okay. As I said, the PDF of this is going to be available, so just let us know. So I'm going to thank you all for listening. Some good questions there. I'm going to hand you back to my host. And again, thanks very much. I've enjoyed this presentation.